Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over an important topic for Mental Health Awareness Month, which happens to be borderline personality disorder. So, for those of you that are involved in the mental health profession, many of you know that this is not an uncommon condition. It's a personality disorder, so technically it's one of the personality disorders rather than a mental illness. But nevertheless, this is still a mental health condition. So this affects how a person thinks and feels about themselves and others, and they manage emotions and behavior accordingly. So how it affects individuals? Well, it affects them emotionally, having difficulty in relationships, self image, impulsivity, crisis and stress, coping. So, what are the types of emotions that are there? Well, they're very intense emotions, and that can change very quickly. Relationships, they may have difficulties with relationships and they may be very extreme types of relationship, like idealizing, then devaluing. So their self image happens to be unstable, sense of self or identity, difficulty knowing who you are or what you want. And then impulsivity, this is a behavior that can be very risky or self damaging. Spending, sex, substance use, driving, things like that. Crisis and stress. Symptoms often worsen during stress, may feel overwhelmed or out of control. And then finally, coping. May use unhealthy coping strategies or self harm. So I went through the list of how it affects individuals, but in a different context, if we think about this as common signs and symptoms of borderline personality disorder, then you can think of this and organize this into 9 categories of signs and symptoms. So, knowing this awareness is especially important when you're dealing with this disorder, or even a healthcare practitioner professionals are seeing this. So, what are the signs? Well, fear of abandonment, whether it's real or imaginary, this is a fear. Unstable and intense relationships, like I said previously, intense or rapidly changing emotions. So, at one minute they may be sad, another minute they may be angry, another minute they might be anxious, just different types of emotions in the whole spectrum. Unstable self image or self sense of identity, impulsive or self damaging behaviors, self harm or suicidal threats or behavior, chronic feelings of emptiness, incorporating intense anger or difficulty controlling anger, and then stress related paranoia or dissociation. So, again, this is a vicious cycle that kind of continues onward like a behavior. Like a negative reinforcement cycle. So the trigger is that it might be a real or imaginary trigger, then intense emotional reaction, and then impulsive or survival based behavior, short term relief, guilt, shame, or emptiness, and then more problems in relationships or self image, and then the cycle repeats. So, uh, real trigger, intense reaction, impulsive behavior, short term relief, guilt, shame, emptiness, more problems in relationships, self image. So that ends up being a trigger. And then there's all sorts of reactions to that. Just to quickly go over this laundry list of potential risks and impact, very important list. So, self harm or suicide risk is, of course, the risk and impact. Difficulty maintaining stable relationships, problems at work, school, or with daily responsibilities, higher risk of co occurring conditions, depression, anxiety, post traumatic stress disorder, eating disorders, substance use, increased use of crisis services, lower quality of life without treatment. So the 4 things that works are psychotherapy, skills building, medication, and support system. Of course, the most important is psychotherapy because this allows, without medication, improvement in people that have borderline personality disorder or BPD. So, some of the techniques that have worked are dialectical behavioral therapy. These have been tested in trials and research to see if they're effective. And then mentalization based therapy, something called MBT. The skills building is especially important: emotional regulation, distress tolerance, mindfulness, interpersonal effectiveness. Um, so these are ways to kind of counter a lot of the anger, all of the different emotions that take place, which are inappropriate and intense. Um, no specific medications are preferred or talked about, but borderline personality disorder is something that can be treated if there are co occurring conditions like, say, anxiety or depression. And of course, very important is the support system. Having groups, people that can be trusted, therapeutic relationships, these are especially important. So, recovery is possible, a lot of things that can be used to treat this. So, having a mental health sort of crisis resources is especially important for individuals with BPD. So, 988 Suicide and Crisis Hotline, Lifeline, is especially important. You can also chat through 988lifeline.org. Crisis text line, text home to 741-741, and then find local resources with findtreatment.gov. So I hope this has been a good brief synopsis of borderline personality disorders. Um, uh, Thank you for listening.